Hi, I'm Sarah Jamal. I'm from the Maldives and I work at the Health Protection Agency under the Ministry of Health. I am currently responsible for managing the National Health Emergency Preparedness and Response Program. The Maldives is a very small island nation and we have around a population of around 400,000. In total, we comprise of around 1,192 islands. Out of those, about 188 are locally inhabited, and we also have 109 private resort islands. And our islands are geographically arranged in chains, which we call atolls. So our health system is basically at three tiers. We have the health centers at the individual islands, and then we have atoll and regional hospitals at the capital island of each atoll, and then in the capital of the country, Male, we have a tertiary hospital. So our RRTs are divided into two levels. We have the atoll RRTs, and then we also have our National Rapid Response Team. The atoll RRTs will be responding to, say, an event or an outbreak in an individual island, and the National Rapid Response Team would be deployed to support the atoll RRTs, or if something occurs within the capital itself. Our teams are not pre assembled. We have rather a list of profiles, and depending on the situation and the nature of the situation, the composition of the team will be decided. Typical health RRT would consist of, say, one doctor, two to three nurses, a public health official, maybe a laboratory technologist if it's applicable. That we haven't had any major disasters or emergencies in recent years. A typical RRT activity for us would be responding to an event or an outbreak in an individual island or in multiple islands, maybe in the same atoll. So, as part of our daily surveillance for communicable diseases, we collect daily statistics from each island. For example, if there is a rise in the number of people coming in with ARI or viral fever in a specific island in one day, this will be usually notified to the atoll hospital of that atoll, and in turn, they would be notifying us at the central level as well. So, there is a good notification system in place. So, if there is a rise in a specific disease noticed in an island, the RRT would be deployed to that island to respond to support the health center staff. Because so for a typical outbreak of, say, dengue or influenza, there would be things like reporting to the central level and to other stakeholders within the island, as well as community awareness and health promotion, investigation of the event if it's something like food poisoning, collecting laboratory samples and transferring it to the tertiary hospital for further testing, as well as carrying out vaccinations when necessary. We have an RRT training package already in place, and this is supported by our Public Health Protection Act, because emergency preparedness and response actually comes under the act, and it is also supported by the Health Emergency Operations Plan, which we were able to get finalized and endorsed last year. And once we get our Health Emergency Operations Center fully operationalized and functioning, it will come under the Health Emergency Operations Center as one of its functions, and this will make it a lot easier for us to coordinate our response and make it a lot faster and more efficient. Out of the 19 atoll and regional hospitals, we were able to have health facility emergency response plans prepared for 16 of those, and out of those, we were able to travel to 14 and conduct full scale emergency drills to test those plans and actually give them feedback on how they can improve it so that they're better prepared for any emergencies in the future. And our RRT training is still an ongoing work. We were able to conduct RRT trainings for 7 atolls so far, and it is our hope that we will be able to cover all 20 of the atolls I think one of the most significant challenges that we faced is a lack of sustainable funding for preparedness, because the idea of investing in preparedness is still seen as like a new idea. So we tend to focus more on response, and we also have very limited human resources. Like at the central level, we only have a few people who are trained to conduct these trainings, and it is becomes really hard sometimes to travel to all of the atolls and conduct trainings. We also have very limited resources at the atoll level. Being a small island nation with like our islands really far apart at some points, I think geography is also one of our most significant challenges, because everything is really dependent on the weather. Even if there is a need to deploy an RRT, if there is a yellow alert out, or if the sea conditions are not favorable, then it becomes really hard to get the team to where they need to go, and it becomes really hard for us to send medical supplies and equipment if it's necessary to that island. Our RRTs are still, very young. And actually, we would love the opportunity to learn from other more as well established RRTs, and, get outside feedback on how we can actually improve our training package and improve our RRTs initiative. And I think we would be more than happy to share what works for us. For maybe it will be useful for other island nations that are similar to Maldives. We are also learning, so it's a work in progress.